Good day, my dear students. Welcome to R.A.T.S in Pathology. Racing against time for students in pathology. And we are all undergraduates, and these are the university questions staring at us. The topic for the day is a short question from nutritional disorders. Vitamin A deficiency. Something that you people are all familiar with. And the mode of questions is given in the box over here. Vitamin A deficiency. Otherwise, vitamin A is called as retinol and is fat soluble. The dietary sources are animal-derived foods such as yolks of egg, butter, whole milk, and fish. As provitamin carotenoid, it can occur in the yellow plants and vegetables such as carrots, potatoes, mangoes, and pumpkins. And I might not have mentioned a lot that is there on the screen. Try to identify as many as is possible. Now, what are the morphological features of vitamin A deficiency? In pathology, we are bothered about the pathological manifestations. And when it comes to manifestations, a small trick of the trade is try to know the site of major manifestation and the other manifestations. Thirdly, it would be logical that we know hypervitaminosis as well. Now, these are the ocular manifestations in which there can be a night blindness, xerophthalmia, dry and scaly conjunctiva, lacrimal duct hyperkeratosis. So there is keratin getting deposited in the lacrimal duct, keratomalacia or corneal ulcers, Bitot spots, impedance or interference to the transmission of light. Finally, infection, scarring, opacity can all lead to blindness. So these are the ocular manifestations which you people should definitely have in mind. Third year you have got ophthalmology. The deficiency itself in the form of a seesaw has been shown as extraocular and ocular. And the same set of conditions are given over here. You can go through them. Easy to recollect. Now, what are the physiological functions of vitamin A? This particular list is important and it will place us above others. 1. Maintenance of normal vision in reduced light. 2. Maintenance of the structure and the function of specialized epithelium. 3. The maintenance of normal cartilage and bone growth. 4. Increase in immunity against infections. And finally, an anti-proliferative effect. People say that it can be given against metaplasia or abnormal proliferation cells. So this particular list we can have in mind. And always the symptoms and signs. Symptom is something that the patient comes with. Sign is something that you as a doctor elicit. So what are the symptoms of vitamin A deficiency? There can be a dry skin, dry eyes, dry lips, night blindness, infertility, delayed growth, throat and chest infections. Probably these are all related to squamous metaplasia, poor wound healing, acne and breakouts, Bitot spots, impaired immunity, thick and scaly skin. Nice list prepared from the nursing notes. So you people can have this in mind, quite useful. And this is just, again, a picturesque view of the same thanks to bold sky. Now, the skin of this patient is having multiple small, firm nodules. There is no ulceration or etc. And it produces some kind of a coarse skin that has been described as a toad skin. So this kind of an appearance called as rhinoderma. Squamous metaplasia. This we have seen n number of times, but I will repeat again for completion. Metaplasia is the replacement of one adult type of tissue by another due to varied differentiation. The definition must not change at all. Normally, you have got a columnar type of epithelium in the endocervix, in the various ducts, such as the salivary duct, the pancreatic duct, or even the ureter. There is a transitional epithelium. But when there is a chronic infection, irritation, or inflammation, this is very sensitive, it is lost. It is replaced by more resistant squamous cells. This is called squamous metaplasia. And at the base of it, this is called the basal layer. So this cell differentiates into a squamous cell rather than a columnar cell. This is called the basement membrane, above which all the changes occur. Thanks to Elsevier and Robbins, they have given a very beautiful line sketch of it. You people can go to it. Always draw this diagram in a metaplasia. And these are the other sources. Also, you find that there can be a keratinization. Sometimes it can solidify. There can be the formation of calculi, etc. Because the function of clearance, secretion, everything is lost. So vitamin A deficiency, squamous metaplasia. What are the sites? These are the sites. Now, my dear students, this is a slide of conjunctival cirrhosis. Look at the picture. This is the cornea. The margin is the corneal limbus, and then there is a conjunctiva. This is a black and white picture, and then this is a color photograph of the same condition. If it is not very clear, see it now. I hope you people are able to appreciate the granularity that is getting formed on the lateral side of the cornea in the conjunctiva. And this is exactly the region over here wherein you get a beach and a sand appearance in the eye. A classical description. Now, this is again a summary of the ocular and the metaplastic changes. So, in the eye, you find that there is the cornea over here. So, there is a corneal ulceration. Also, you get a condition called as keratomalacia. In the conjunctiva, we can get areas of roughening and granularity called the Bitot spots. The other changes are all mentioned. You people can go through them elsewhere in this presentation. Now, these are some of the ocular changes. And here I am finding the columnar epithelium getting replaced into a squamous epithelium. And this can lead to a malignancy and a dysplasia and a malignancy. Also, there can be an obstruction to the urinary tract. So these are the ocular and the metaplastic effects of vitamin A deficiency. This is a beautiful pyramid that we shall remember. There is a dietary deficit, there is a depletion either in the tissue or in the plasma, there is altered genetic and metabolic function leading to systemic effects. and there is a greater mortality or a morbidity. And here there can be metaplasia when there is a mild deficiency, but later on it can result in keratomalacia, corneal ulceration, and night blindness. So this alone would suffice for us to recall the effects of vitamin A deficiency. Again, a beautiful picture. There is a granularity at the same time. If I observe carefully, there will be a foamy appearance that can be made out. Look at this one. It is described as a patchy and a foamy appearance on the lateral side of the conjunctiva. Same thing over here. And also here. So it is superficial, large, triangular, foamy, and keratinized. It occurs in the region of the bulbar conjunctiva, and it is on the temporal side. Repeated pictures of this so you people can catch them quite easily. It can be a spotter or a short case for you in ophthalmology. So there is a xerosed conjunctiva, there is a layer of foam on the surface. Keratomalacia is another condition. The function of vitamin A we had seen. It leads to specialized epithelium, as is seen in the cornea and the conjunctiva. So when there is a deficiency, this is affected. The vitamin A also is important in the specialized epithelium on the surfaces of the body, such as the ducts and so on. The deficiency will lead to atrophy and then loss of the goblet cells, loss of the columnar cells. And there is a replacement by columnar cells and keratinization. Please see in this picture, the substantia propria of the cornea breaks down. It liquefies and results in an opacity which is called as keratomalacia. So white hot spots we had seen, keratomalacia is another one. Normal and the night blindness. So this is a picture of the fundus that is over here. I am not an expert in it, but obviously there is a difference that I am seeing in this region. So what is the basis of the so-called night blindness? Nyctalopia. This is another word for night blindness. Comes from the Greek word, which means night blind or invisible. Look at this picture. It is a picture of a person seeing with night blindness. There's a car coming out. Of course, there is a dim or a decreased light, and this is what he can at the most visualize. Quite dangerous for driving. And thanks to this person in Wikipedia, he is the author of this picture. Again, go through the various components of the eyeball. The cornea, sclera, the iris, the retina over here, then the optic cusp, the optic nerve, etc. But what is important to me in this class is there are normal signaling pathways. There is something called as rods and cones. Now this can be incomplete. See, it is becoming somewhat haphazard with some impairment, or sometimes there can be a total loss of it, leading to no signaling from the rods. So there is a complete kind of a blindness. So natural eye care is the source of this particular picture. If you have the time and patience, this is a beautiful drawing that you people can draw even in your ophthalmology. Always I mention, whenever there is a deficiency, there can be an excess also. And the excess can be acute or it can be chronic. In acute toxicity of vitamin A, there can be vomiting, neurological symptoms such as headache and stupor, papilledema. Chronic, on the contrary, again there can be increased intracranial pressure, headache, skeletal pain, bony pain can be there. Hyperkeratinemia can lead to the xeroid pigment or a yellowish pigment. Cutaneous, there can be pruritus and the coarseness of hair. Hepatomegaly and other parenchymal damage can also manifest. So there is acute and chronic. And this is the vague and dull outline that we can see in the case of a night blindness. The only thing worse than being blind is having sight but no vision. I think it applies to many a person. Helen Keller, an author who was deaf, dumb, and blind, but then a fantastic student of Aristotle. Thank you.